Hey DB2 fans, Doug Bouldin here, and today's topic is hip pain. Let's start by discussing the most common causes of hip pain. Hip pain can be generated from osteoarthritis, bursitis or tendonitis, or labral tears. Let's talk about each one of those individually. Osteoarthritis is a degenerative process that occurs as a result of common wear and tear over time, but it can also be provoked by a sentinel injury that occurs at some point in time regarding the hip. Either way, once the development of osteoarthritis starts, spurring and uneven surfaces where the hip normally articulates smoothly can generate inflammation and subsequent pain. Determining that origin can be as simple as a thorough physical examination or a plain x-ray. When it comes to determining the origin of other sources of pain regarding the hip, that physical examination is a critical part to determining where that pain may be coming from. Other sources can be generated from conditions like bursitis or tendonitis. Bursitis is where the small lubricating sacs that surround the hip joint itself can become inflamed. Typically, those sorts of origins of hip pain can be treated effectively with steroid injections or physical therapy. But if that doesn't fully resolve the condition, repeated steroid injections can actually become deleterious to a joint. And finally, labral tears. A labrum is a piece of connective tissue within the joint itself, and it surrounds the cup or the acetabulum of the hip. And it is what the head of the femur fits into and completes the socket of your hip. Tears in the connective tissue of the labrum can occur from excessive use, overstretching, or high-impact sports like gymnastics, football, soccer. We've seen a multitude of younger athletes suffer labral tears that then predispose them to setting up osteoarthritis later on in their life. Regardless of what condition ultimately generates pain in your hip, a good physical examination can help steer us in the right direction without performing unnecessary diagnostic imaging. Oftentimes, a plain x-ray can elude a lot of background into why a patient has pain in the hip. However, when a plain x-ray fails to reveal the origin or any clues as to the pain, MRI or ultrasound can often fill in the gaps. So let's change pace a little bit and talk about what we do here at DB2 Regeneration for patients who have hip pain. One of the first and primary things is developing a rehab plan. A rehab plan that involves range of motion, stretching, and strengthening in order to improve mobility and lessen the compensatory effects that can occur with hip pain. Once the rehab plan is laid out, we can begin to approach pain levels and reducing inflammation and trying to develop as much regeneration in that hip joint or the surrounding soft tissues as possible. At DB2, our medical team is thoroughly experienced in regenerative medicine techniques that can result in the kind of outcomes that improve your quality of life. Platelet-rich plasma is a blood product that's harvested from you yourself. It's the abundant growth factors and anti-inflammatory factors that are beneficial for our patients who suffer hip pain. Using ultrasound guidance, we're able to deliver platelet-rich plasma directly into the joint space with little discomfort at all. Once those cells are delivered, they then begin to modulate inflammation downward and allow for healing to take place. And when combined with a rehab plan, outcomes can be exponential. If there's a significant degree of osteoarthritis, then cellular therapies can also be employed in conjunction with PRP injections. Typically, it's a series of 3 that provides the best result when we discuss PRP. And if cellular therapy is appropriate and the patient is a good candidate, then that therapy can be sandwiched between that series of PRP injections. In our practice, 80% of the patients that we treat, combined with rehabilitation techniques, experience less pain and improved mobility. And for each individual, the outcomes may be different, but the goals are the same. and that's to have you experience less pain and better mobility so that your quality of life can be maximized. If you've been suffering hip pain and left with very few answers as to its origin, give us a call. Let us evaluate you and see if regenerative medicine is a good alternative for you. We're right here waiting for you at DB2. Thanks for stopping by.